Two words: excitement and hope. That's what I felt when Tammy notified me that some money broke free and we were going to be able to do something like this. She went to Steve, went to the board, and here we are. I want to thank everybody on the behalf of Mental Health Sciences for you all coming out today and joining us. This is a momentous occasion, especially for me. I've never had the opportunity to be involved in a project like this. The impact of this endeavor is huge. I'm not quite sure many people understand the cost of mental illness, the trouble we're having with it here, and how this is going to solve a lot of problems. There will be a dramatic expansion in services to the community from a mental health perspective. We're going to have an adult unit, geropsych unit, and more importantly, an adolescent unit, which is very rare. There will be an expansion of the outpatient services as well. We will be also introducing other types of treatment modalities to the mental health service line. Perhaps the biggest impact is going to be to the emergency department. Over the past 5 years, there's been a surge of mental illness patients descending upon the emergency department for care, which created a phenomenon called ED boarding. This is where patients come to the emergency department seeking help, need to be hospitalized, but have to sit in the emergency department for weeks on end, waiting for a bed to open up in the community. I never saw this in the past. The first 3 years I was here, I went to the emergency department 3 times. Now my service is there every day, seeing multiple patients. We did a 3-bed carve-out to help facilitate and take some of the strain off the emergency department, and it was immediately overrun. We will now have our own place to take the patients, and they won't have to sit in the emergency department. Think about sitting in a small room, 10 by 10, for 2 weeks with no TV and just a bed. Yeah, it's pretty scary. That will all change. Probably one of the most important things is an improvement in continuity of care. What I mean by that is I have outpatients, and when they need to be hospitalized, they have to go somewhere at least an hour to an hour and a half away, either Penn Highlands, Clarion, or one of these other facilities, and be treated by a psychiatrist that knows nothing about them. Communication between outpatient and inpatient physicians is not optimal. Very often my patients come back with a completely different regimen of medications that is not working for them. Now I'll be able to control the environment and the treatment care of my patient from outpatient to inpatient. This is huge. It's going to be a game changer. The future. As I mentioned earlier, there will be a massive expansion of services. I look forward to the construction, working on the construction, the implementation, and the constant optimization of this facility in order to maintain excellence of care for our patients. We will also start a psychiatric residency program. I'm very excited about this. We will expand education. We have a commitment. The reason it's so hard to get an appointment with a psychiatrist is there's not enough psychiatrists. The average age of a psychiatrist is 50. 50. That's pretty scary. And we're not generating new ones because of problems with reimbursement, training, availability, et cetera. So we're dedicated here to have a medical school program. We work with LECOM and PCOM, as well as extender programs. We support the family practice residency, and now we're going to have a psychiatric residency as well. And finally, ECT, probably the most effective treatment modality in all of psychiatry. We will develop and implement that program. The future here is limitless, and I'm very excited to be part of it. Thank you.